Hello, everybody. It gives me immense pleasure to bring to you this pre-conference tete-a-tete with none other than Dr. Rukshana Shroff. Ma'am is a pediatric nephrologist, a leading pediatric nephrologist practice in the UK, and she shall be enlightening us on the topic of CKD mineral bone disorder this year in Winicon 2023. So, as she gears up for the talk and prepares to enlighten us, let's go ahead with a few questions, ma'am. Could you please explain briefly why CKD-MBD is particularly important in pediatrics?
Okay, first of all, thank you, Isha, and thank you to the organizers for inviting me. I'm sad that it's a virtual event and I can't be in Bangalore again, but thank you. So CKD-MBD is one of the most common and the most pervasive of problems, especially so in children with kidney failure. Children should be growing, and their growing bones need a lot of calcium to keep them well mineralized. In the presence of untreated, undiagnosed, untreated, or incorrectly treated CKD, mineral bone disease becomes highly prevalent. It includes a lot of symptoms for the patients, which include bone pain, rickets, or fractures. And of course, it is also very closely linked with cardiovascular disease. The most important part is that this is a preventable complication, and therefore early diagnosis and appropriate management is extremely important.
Absolutely, ma'am.
Thank you.
So, as a leading pediatric nephrologist, we would love to know what inspired you to opt this particular branch of nephrology.
Okay, so I did my initial pediatric nephrology training in India, in Mumbai, and then came to the UK for further studies. I've always had an interest in managing patients with chronic diseases, as well as doing some acute nephrology as well, and acute management as well. And nephrology gave me that opportunity of having the hands-on treatment with biopsies, catheters, dialysis, etc., as well as developing a rapport with patients and families over the long term, and in helping them through some of the most difficult times of their life.
We would also love to hear from you, ma'am. What do you think about WIN India, Women in Nephrology India?
Thank you. So I'm particularly delighted that this conference is by and for women, and very strongly promotes the role of the female physicians. Women play an extremely important role in medicine, particularly so in pediatrics. It's often an under-recognized feature. In fact, living and working in the UK, I was recently shocked to see statistics which show that female researchers are less well-funded, less well published. That there's a huge innate bias in terms of supporting and promoting female researchers. And even in the clinical world, in the UK, women can be paid 30% less than their male counterparts for doing the same job. So it is not a problem only in India. It's very much in the developed world as well. And I can only imagine it's perhaps even more prevalent in India. And so recognizing and promoting women in medicine is fantastic. So congratulations to you and your team for doing that.
Thank you, ma'am. Any final message for Winicon 2023?
Now keep going and go strong. You're doing a very important piece of work, and I hope that this gets recognition and is seen widely and promoted by everyone. I hope our male colleagues will see what a wonderful job this conference will do, and will maybe have to have a mini con with men in nephrology sometime. Who knows? But thank you. Well done.
We are eager to learn from you, ma'am. We are looking forward to listening from you. Thank you so much, ma'am. Thank you so much for joining in, and thank you so much for your time again. Thank you, ma'am.
My pleasure. Thank you, Isha.